House Speaker Mike Johnson is currently struggling to keep his party together to vote on Donald Trump's big, beautiful, stupid bill. And for the best possible reason he's having his trouble. It's the Medicaid cuts, which we've been talking about literally ad nauseum. I know I'm nauseamed here on the show, and so that's good. So he's got this group of moderate Republicans that are not a big fan of the cuts, or probably more likely how drastic the cuts are gonna be. I think there's probably some level of cuts that they'll end up agreeing on, but they're not happy with it. And so we've got a lot of catching up to do to see if it's likely to actually pass. But Johnson was talking about some of these issues, and he said, I said likely for a reason because it's not a final decision, talking there about ruling out a move to cap federal funding per Medicaid enrollee. So this is yet another one of the ways that they're trying to cut Medicaid without seeming like they're cutting Medicaid. This one's new to me. We're gonna cover through some of the old ones too, but they're still iterating on that. And so on multiple different fronts right now, we have these little pockets, some smaller, some bigger, of lawmakers that are threatening to tank the entire thing. And as always, remember, it's not like he has a big margin of error. He's got an incredibly narrow majority because the last election was incredibly close. So let's jump through some of these different groups. So moderates are rebelling against per capita spending caps. Moderates is what Axios is calling them. I want to be very clear. Just because you're not as far right on this particular topic as Mike Johnson does not, to me, make you a moderate, but that's what Axios is saying. As well as shifting some of the cost burden to the states. The House Freedom Caucus roared on Wednesday, restating the original deal that every dollar Congress wants to go beyond 4 trillion in tax cuts will require an equal number of cuts above the 1.5 trillion mark, which I guess is them being, it's them pretending to be like responsible, like, hey, if you're gonna give all this money to the wealthy, which we really want you to do, you also have to match it by screwing over the poor. After $4 trillion, like I guess you get like the first $4 trillion free. That's what passes for fiscal responsibility and discipline on the right. Whatever, it doesn't even matter because the entire thing is just the guys to cut more spending for poor people. But anyway, why? Why are the moderates, as Axios calls them, kicking up such a fuss over Mike Johnson? Well, more and more reporting has been coming out, and we've been trying to cover as much of it as we can here on the show about how devastating these cuts would actually be. Both how devastating in fact and unpopular in practice they would be. So new analysis, HuffPost reporting, GOP plans to cut Medicaid would kick millions off of their health insurance. And so the CBO says that the various proposals, and there's a lot of them, to shrink the federal share of Medicaid costs would force states to pay more, shortchange healthcare providers, trim benefits, and reduce enrollment in the program. Because look, it's easy to say, and that's why they're doing it, that we're not gonna pay for it. States will get it. They'll pay for all of that stuff that we say is unsustainable. Well, if you've been alive for the past couple of years, last decade or so, you know that Republicans have had every opportunity to expand access to Medicare and Medicaid, and they don't do that. In many cases, they refuse to accept federal funding to do that. They don't want to expand it because they don't care if people have access to these programs, or if they have access indeed in a more real sense to health insurance literally at all. And so many states are automatically gonna do literally nothing to make up for the shortfalls. They're just gonna allow these people to be kicked off. And then they're likely to run ads about how those people are lazy and they should be working harder if they want access to health insurance. So the entire thing is absolutely grotesque, but it's also grotesque in a more granular way. And I wanna turn to that now. So we have reporting from David Dayen of American Prospect, great journalist at a great outlet, indicating that Republicans are considering yet another way to effectively cut spending on Medicaid. This is like the fifth, I guess, as Donald Trump continues to say that he's not gonna allow cuts to it or whatever. So here's what the American Prospect says. Under the GOP proposal, quote, Medicaid recipients making at or above the federal poverty level, which is less than $16,000 for a single individual, I remind you, would have to pay some money for coverage, either in premiums, co-payments for hospital visits, and other treatment or other fees. So basically now, because they're making effectively no money and they don't have any bit of a buffer to spend on this sort of stuff that has been covered by the federal government in some cases in recent years, they would now need to do that, which will mean for many of them, that's it. They cannot cover these visits, these fees, that will be it. They will not comply. And I will remind you too, that in the same way that every single step along the way of the fighting waste, fraud, and abuse has been making moves that end up costing individuals and indeed probably the American government and American society more money in the long run. This is undoubtedly one of those things, because you have people who are in a relatively efficient way getting access to healthcare. Instead, they're not going to. They're going to get sicker. Some will die. It's going to make it harder for businesses that won't be able to rely on those people because they won't be there because they'll be sick or they'll prematurely die. It's gonna wreck families. It's gonna do untold damage to America and its economy. But screw them, they're poor, they're lazy, they're not deserving. That is effectively the message that we're getting from Congress right now. But let me finish a little bit more from what the American Prospect said. David Day in reporting, currently, Medicaid gives states the option to impose out-of-pocket spending on recipients, though some populations and services like children under 18 or pregnancy care are exempted. Some premiums and enrollment fees are limited to beneficiaries above 150% of the poverty line. This policy would take that number lower, again, to potentially, for an individual, less than $16,000. People who are living whatever the, again, definitional exact opposite of the lives of like a Donald Trump and Elon Musk, $16,000. I literally don't know how you survive. There's no wiggle room to pay for any of this. This is booting people from the program. That's literally all that it is. Many of them, by the way, conservatives, many of them MAGA. They've got their red hat if they could afford that on their incredibly limited income. Many of them voted for Donald Trump, and they could lose access to these services that they, again, this is not like a luxury. This is literally life and death. And by the way, we're focusing on Medicaid because they seem to be going more gung-ho for Medicaid recently, but Social Security is the next big battlefield. We'll be covering that too. There's 15 House Republicans who are warning Trump about Social Security cuts, which I have no doubt he's gonna say that we're not gonna cut, but that's not worth anything because he said that from the very beginning about Medicaid. Meanwhile, we are marching down like 5 separate sets of cuts to Medicaid. It takes a lot of work. It takes a lot of cruelty, inhumanity to cut nearly $1 trillion from Medicaid. But these are some of the very innovative ways that they are working on doing exactly that. And so again, like we already have massive cuts in terms of workforce to Social Security. Many people who have to interact with that system are finding it more and more difficult to actually get access to the benefits that they've paid into for decades at this point. And they're talking about even more drastic cuts to the workforce and to the technology, but also likely to the benefits. And for those of you that are on the younger side, you need to understand they're coming for your retirement age. That's what they're gonna do. It's gonna be pushing it back 2 years, 3 years, 4 years, more work before you finally get access to Social Security. That's the next battle after this one. If you enjoyed that, then make sure that you never miss another video by subscribing. And if you want a little more, consider hitting the join button and becoming a member. So you're probably wondering, why would I do that? Well, when you do that, you get access to bonus content that I make every single week, and it's a lot of fun. You get custom emojis and more. If you join at tier 3, by the way, you even get access to a monthly member hangout with myself. And you'll get all that going forward, but you'll also unlock years of the back catalog that is literally 100 or more bonus clips and top 10 lists and debates and more. So what are you waiting for?